Hello, and how are you? My name is Winnie Barawa. Welcome to our session on policy concepts. If you're new here, this is a session or a YouTube channel where we focus on health, its lessons, lectures, and sometimes we bring in expert interviews who take us through different topics. So in this lesson on policy, the main focus is health policy. However, we will be discussing more in details how the different aspects of policy comes around. But before that, let's focus on a little bit of the different concepts that are part and parcel of health policy, and that is good for us to understand before we go forward. So let's begin with simple terms like institutions and the word policy itself. So according to health policy, institutions basically refers to rules of the game and determines how the government and the wider state operate. So when you are dealing with policies, you mostly deal with institutions or organizations that provide how the rules run, and they determine how the government or even wider communities operate when it comes to these rules. But then we have the word policy itself. And in the word policy, this brings up a broad statement which carries the goals, objectives, and means that help create the framework for any activity. So for instance, if you want to form a certain type of law, there are different actions or there are different steps that one has to follow until that particular law comes to life. So this, in summary, you can say that's a policy. A policy is able to state or to clearly provide what are the goals, the objectives, and the means of creating a framework for certain activities. And the other bit is about policy elite. So in policy elite, we look at a specific group made up of policymakers who hold high position in the policy system and they got privileges when it comes to accessing the top layers or the top members of the organization. So an elite basically means someone with privileges or someone with more rights or access to certain systems that others don't have. So even in the policy system, there are those people or guys who are in the highest of order and they can access some of these things that others are not able to access in the policy systems. So it could be maybe in an organization, or it could be in a given state of operation, or it could be in a given government. So a policy elite is this group of policymakers who have very high positions in the policy system and they've got privileges that others can't access. So let's keep on with the definitions, and the other part is policymakers. So a policymaker or policymakers in plural are those individuals who have who are able to make policies or participate in the policy making. Now, they could participate in this policy making in different spaces, could be in the central or local government. They could be making these policies in companies, which could be local companies or multinational companies. It's also be possible that could be making a policy in a local hospital or government or a business. But basically, a policymaker is the person who participates in the making of the policies. But then we have the policy processes, and a policy process is a way in which policies are initiated, formulated, developed, negotiated, communicated, implemented, and evaluated. So a policy process provides a pathway of how a policy starts until it's fully developed to be now operationalized. So you find the definition of this statement or the definition of these concepts highlights the different steps that a policy becomes effective, or a policy can be adopted to be taken as rule of the law. So there's the step of initiation, formulation, developing, negotiated, communicated, implemented, and evaluated. I hope that makes some sense. And then we have the policy area. So when it comes to policy area, what we are checking on here, we are looking at in which particular spaces can policies be made. So it can be diversified. It could be policy area, could be in health. Like in this case here, we're talking about health policy here, meaning we'll be making policies particularly covering issues of health. It could be environmental policies, it could be education policies, it could be trade policies. Basically, a policy area is a defined specialization of specialization where the policy focuses on, or it's an area of focus that the policy is being formulated for. And then we have public policy, which is a type of policy actually. And a public policy refers to government policy or policies that are made by government agencies. So for instance, in all our countries or nations, we have the ruling government, or we have the government that is still in power. So the government is mandated to form different policies that are supposed to guide us in our day-to-day operations or activities. So a policy that has been formulated by the government or has been formulated by government agencies, then we will call it public policy, because the agenda of public policy is to operate and provide government guide the government and the public on the ways of the land, like what should be done in particular scenarios or what should be done when it comes to certain areas. So let's focus on the policy bit now. Like we've defined policy and said this is a statement that helps us understand how the rules of the game work. So what is policy now in this case? So a policy in simple definition is a principle. It can be a plan that is able to guide decisions, actions and the outcomes. So a policy in summary is a certain principle, or it could be a plan, or it could be a document that has been put in place whose role is to help guide the decisions that are supposed to be made, guide also on the actions, and also guide on the outcomes. And in this case, policies can exist in different ways. It can exist as written documents, and it can also exist as unwritten practices. Meaning, you don't have to put it in a document, you don't have to put it in a laid down document that needs to be read or any. It could be something operating in a way that is unwritten, but people know that is in existence. So policies can come in different forms. It can be laws, it can be documents, it can be procedures, guiding principles, or statement of intention, or working frameworks. So the main purpose of policies is to help or to guide specifically either different areas of work or different areas of specialties in terms of how to operate, provide actions, and guide on the outcomes. So that's how policies come around. So these policies, mostly it said they could either be large or they could also be areas that are in practice. So they say there could be some discrepancy how we look at the policies, and we'll come later on to this, where we are looking at the different types of policies and how they operate. So we are told there is policy of intent and a policy of practice. So intent or policy of intention is a state where we say what is planned, stated, or written, while policy of practice or policy as practice is what actually happened. So for example, we have policy documents in our countries, and like we had said, the policy documents in our country are required to elaborate to us how different processes should happen or how different actions should occur. But now there's the exact policy of practice that is operating on the ground. Now this is what actually happens. So you may be told policy provides that if you need to be admitted in a hospital, in government hospital for instance, let me use the public health policies. So it could be required, like if you're going into public hospital, there's a requirement like before admission, you need to pay some maybe down payments, or you need to have certain documentations, and that's what is written. And there's a list of all these documents that you need to have, which is good. But now when you come onto the ground, there are those areas which are of compromise, and there could be some areas where you don't really have to practice even if it's in the policy. So now this is the difference. So the policy of intention is what has been documented and planned and what is expected to happen. But on the ground is the policy of practice. That is what actually happens on the ground in terms of the implementation of this policy. So I hope you get the difference. What is written down to happen and what is actual happening. So in every policy, you need to appreciate that it's very context specific and can be influenced by different factors, including factors that could be social, cultural, economic, and even political structures. So when you're looking at these policies, you need to appreciate that it could have been influenced by different factors. And these factors are not limited to just government or political ruling. It can be even with the economic status that is in place at that particular moment, or the culture that people believe in, or the ways of life. And so all these guides and provide a guideline on how things operate. So different people try to define policies, and Koontz and D'Donnel say that a policy is a general statement. I'm repeating this so that we get to understand what a policy is as we go on and on to discuss other parts of the policy. So a policy is a general statement which guides thinking, decision making, and even the action, which I've actually defined before. So policies also are general statements which guide and channel the thinking of all personnel that are being charged with decision making. Why are we here with this is because policies most of the time are expected to be guided by decision makers or people who hold an office that requires them to operate with decisions. So it's quite important that these individuals are able to understand these policies. And by policies here we are meaning the general statements that guide or channel the thinking of their decisions, their actions, and their outcomes. So let's summarize on the definition bit. So a policy is a law, a regulation, a procedure, an administrative action, incentives, or voluntary practices of the government or even other institution. So I believe by now we've had to understand how policies are or what policies are and what impact they can bring. That is in terms of where can they take place, that is policy areas, the policy elites, policy makers, and you can see the institutions where policies can take place. So thank you so much for staying with me all the way to the end. And if you're enjoying these lessons, in this particular lessons, we're going to focus on policies, and our focus is health policy. So give it a like if you enjoy these videos. You can also comment, share this video with your platforms, and also remember to subscribe if you've not yet done that. See you and ciao. See you in the next class.